Before antibiotics, before sterile gloves, before modern operating rooms, there were men who walked into the chaos of battle, not to fight, but to save. While swords clashed and arrows sang through smoke-filled air, they moved through the carnage with steady hands and iron nerves. Most armies left their wounded to die screaming in the mud. Rome chose differently. The Danube, blood-soaked earth. 3 hours of relentless slaughter. Arrows, javelins, the crack of bone, the silence that follows a man's final breath. But behind the Roman front lines, something extraordinary was happening. Organized, disciplined, almost impossibly humane for its era. This wasn't just medicine. This was Rome's most underrated weapon, and it may have been the very reason the empire lasted as long as it did. Most ancient civilizations believed illness was divine punishment. You got wounded? The gods were angry. Treatment meant prayer, sacrifice, ritual. Rome looked at that and took a different path. Through contact with Greek medical tradition, the legacy of Hippocrates himself, Rome began building something radical. A medical system rooted not in religion, but in reason, observation, documentation, repetition, results. The man at the heart of this system was called the medicus. Not a priest, not a mystic, a trained professional. A military doctor, a man whose weapon was knowledge. Imagine being a young Capsarius, a Roman battlefield medic. Your name isn't carved on any monument. No general will sing your glory. But strapped to your side is the capsa, a cylindrical case packed with linen bandages, vinegar, and surgical tools. Your uniform smells of iron and herbs. The trumpet sounds. The lines collide, and you run forward, not away from the chaos, into it. You drop to your knees beside a soldier whose thigh has been torn open by a Dacian blade. His eyes are wide. He's losing too much blood. You pour vinegar into the wound. It hisses and foams. He screams. You work faster. You've done this before. You'll do it again. You don't pray. You act. If the Capsarius saved men on the field, the Valetudinarium brought them back to life. Rome's military hospital wasn't a tent, wasn't a muddy corner of a camp. It was a purpose-built architectural marvel, excavated at sites from Scotland to Germany, Inchtuthil, Novaesium, Vetra. These hospitals shared a consistent, standardized design that speaks to imperial-level planning. A rectangular building, a central open courtyard for light, air, and movement. Surrounding it, rows of small private wards, each holding just 4 to 6 patients. Why so small? To limit infection. Running water fed directly into the building. For cleaning wounds, washing instruments, maintaining hygiene. The Romans didn't understand germ theory, but they empirically knew that clean wounds survived. They didn't know why, but they knew that it worked, and that was enough. Inside the armamentarium, the hospital's pharmacy and instrument room, lay tools that would shock you. Scalpels, forceps, bone saws, trepanation drills, yes, brain surgery, and the spoon of Diocles. A curved instrument engineered specifically to extract arrowheads without enlarging the wound. We have proof these surgeries worked. Skeletal remains from Roman military cemeteries show healed trepanation marks. Skulls with surgical holes that grew new bone. Those patients survived. They recovered. Some almost certainly returned to fight again. Pain management existed too. Opium, mandrake root, large quantities of wine before a procedure. Crude by modern standards, but intentional. Rome actively tried to reduce suffering. That alone separated it from almost every military tradition of its time. And when a limb turned gangrenous, they amputated. Cleanly. Deliberately. Because a dead soldier helps no one. But a one-armed veteran still carries knowledge, experience, and loyalty. Here's what strikes me most deeply about all of this. These weren't nameless bureaucrats following orders. These were men. Doctors, medics, nurses, who chose to run toward the screaming. Think about the bond that creates. A Roman legionary knew, truly knew, that if he fell in battle, someone was coming for him. Someone trained, someone equipped, someone who valued his life as a strategic asset worth protecting. That knowledge changes how you fight. It changes how you trust. It turns a collection of soldiers into something more cohesive, more resilient. A family bound not just by oath, but by the certainty that they would not be abandoned. Rome didn't just build hospitals. Rome told its soldiers, "You matter enough to save." As the Western Empire fractured and fell, this system collapsed with it. The valetudinarium was abandoned, the trained medici scattered, the institutional knowledge, centuries of accumulated surgical wisdom, dissolved into the chaos of the Dark Ages. Medieval armies returned to what Rome had left behind: prayer over wounds, ritual over reason, death over doctrine. For nearly 1,000 years, soldiers died from infections that Roman surgeons had learned to prevent. They bled out from wounds that Roman medics had learned to close. The knowledge didn't die all at once. It just faded, ward by ward, legion by legion. But here's the thing about true innovation. It echoes. Galen, the greatest physician of the Roman imperial period, spent years treating gladiators and soldiers. His writings, deeply shaped by military surgical experience, became the foundation of Western medicine for over 1,000 years. The small ward hospital design, triage on the battlefield, nutritional care during recovery, the separation of patients to limit infection. Look at any modern military medical doctrine, any of it, and you are looking at the ghost of the valetudinarium. Rome didn't just win battles with swords and shields. It won them with knowledge, with care, with the radical idea that a wounded man is worth fighting to save. And perhaps the most quietly revolutionary thing Rome ever did was teach the ancient world that medicine advances not through prayer, but through paying attention. We remember Rome for its legions, its roads, its emperors and its conquests. But maybe, just maybe, its greatest legacy walked not with a sword, but with a capsa full of bandages and steady hands that refused to let a man die alone. Before tanks came shadows with teeth. Before modern hospitals came men who ran into chaos to bring people out of it. That is the Rome they don't always show you. If this hidden chapter of history moved you, if you felt the weight of those steady hands in the mud, leave a like, drop a comment, and subscribe so you never miss a story worth remembering. And as always, may history never be forgotten.